I must say I owe you a lot to the knowledge and to the experience and to the, let me say, the prayers I get from the patients nowadays.
And we want to make people not only healthier, but also happier.
And you touched upon a very important point when you spoke about communication. And this is one of the golden keys that I learned when I visited your facility, your amazing facility.
Finally, in order to prevent severe complications like the loss of length of the penis, you can recommend straight penile prosthesis.
لكل داء دواء. For every disease, there's a remedy. Doctor, will my wife know about the surgery? I mean, can I hide it from her? اهلا بيكم. معكم دكتور احمد راغب، استاذ مساعد جراحات المسالك البوليه والتناسليه وحكيم زراعه الدعامه الذكريه المصري. اهلا بيكم في برنامج قعده دكاتره من ميديكازون بودكاست. النهارده معايا ضيف عزيز جدا وغالي عليا جدا جدا جدا. هو مش بس مهم، هو غالي عليا جدا. اخ عزيز وزميل فاضل في مجالنا، مجال الذكوره وجراحات الذكوره وجراحات المسالك البوليه والتناسليه. Welcome, Professor Osmanoff, or I may say Daniar, my dear brother. Professor Daniar Osmanoff is the professor of urology, the vice chair of the Department of Urology at University Hospital Schleswig-Holstein, campus Lübeck. It's not just an honor to have you in Egypt, in Cairo for the first time. It's a delight. It's a pleasure. A moment I've been waiting for ever since I left Germany and came back to Egypt. It's great to have you, Daniar.
Thank you, Ahmed. Thank you for invitation. Thank you for having me with you. And I spent 2 wonderful days in this wonderful city and found myself in a very friendly atmosphere with a good friend of yours, with a wonderful city, Cairo. And thank you once again for the invitation.
You're welcome. It's our pleasure. And I wish it were more than 2 days, but I know that you have a very tight schedule and you have obligations at the meeting, the Egyptian Association Urology meeting tomorrow. But I'm thankful that we could squeeze 2 days before the meeting.
Yes.
It's great to have you.
Thank you so much.
Daniel, remember the very first time we met in Germany? I'm not just proud to be your fellow, but I'm proud even more to be your very first fellow by the European Society of Sexual Medicine at your Center of Excellence. Remember the very first time, and to compare between that time and now when you came, and always the feedback I give you about the patients. And I mean, I must say I owe you a lot to the knowledge and to the experience and to the, let me say, the prayers I get from the patients nowadays.
Thank you. And that's the most important part, because we are working for our patients and we want to make people not only healthier, but also happier. Because in comparison to the cancer surgery, where you're treating threatening situations and want to save the life of the patients, we are giving the patients hope and they give happiness again. And so, of course, I can remember you came. It was a very rainy day in November, and you came from the FECSM. Of course, I knew about you, but that was really shining in our department. He was Dr. Ahmed Ragheb. He's smiling all the time, and he brought some souvenirs. And I even had a column, the famous Egyptian column with my name. That was surprising. And we started with the surgeries from the first day, and it was coincidence of many occasions, because I had 2 days later, after his first day, masterclass with Stephen Wilson. He's a father of prosthetic urology, and as my father, my surgical father. And so you could attend on the meeting, and then we had a lot of surgeries together, and you saw difficult cases, you saw easy cases, you saw also how I communicate with the patients, and they gave you the whole information which was actually planned as it is from the beginning, from the European Society for Sexual Medicine, to give the opportunity young urologists from all the world to be trained in the appropriate center, the Center of Excellence, as you mentioned, to obtain the qualification of prosthetic urologist.
Correct. And I attest to every word, especially the mission and the vision of the European Society of they have the number one goal is training, education, patient awareness, the same dedication to the patient as to the physician as well. And you touched upon a very important point when you spoke about communication, and this is one of the golden keys that I learned when I visited your facility, your amazing facility, is learning how to communicate with the patient. I think that is key to our success. And for a successful surgery, it's not just the technicalities and just performing a excellent surgery, because I always say that this talent, I mean, this you could learn from your colleagues, from your mentors, from your professors, but to properly manage the patient as a person, as a couple, to properly understand your patient, to set up his expectations, to understand his expectations, to handle the psychological part of our service. I think that's more important to properly counsel your patient. I think that is key to a successful surgery. And when I say success, I don't mean just a surgical success, but to succeed in making your patient and couple happier. That's number one. And number two, if you don't know, but Professor Wilson, when he came visiting Cairo, as you call him, Papa, and he considers you one of his sons around the world, he said, I mean, since you were taught by Daniar, and Daniar is my son, then, I mean, he didn't realize that we were more or less the same age, only a small difference that he calls me now his grandson, because I was learned from you. Yeah. So, yes, I'll always be in debt to you, Daniar, for this. And the best part is that our relationship continues on and on. And I think that when I first came for my fellowship in Germany, it was just the beginning of the good things that are going on, our collaborations together, the research, the endless ideas of research.
Yes.
And I hope for that to continue on and on.
I agree with you, and I think the most important thing, if you're talking about our patients and their satisfactions, and not only patients but the couples, as you mentioned, that in my principles, and I'm very glad that you could learn it. First of all, avoid unrealistic expectations. Try to be fair to your patients and to tell the truth to patients, because sometimes people want to hear something good and nice, what can happen to him after your surgery, but try to be realistic, because we are not the magicians, we're just the surgeons. And one of the main principles for me, which is second, is to be honest with yourself, because if you cannot do this particular surgery, if you do not or have never done this or other type of surgery, never try to do it, because the patient is not the rabbit. So you have to be properly trained, and you have to know how to do the surgery before offering this to your patients, and which is mostly important to treat your patients as your own son or as your own father. If you do this, you will never make a mess, you will never do a mistake, and you will try to keep your reputation and reputation of the place where you're working ongoing.
I love what you just mentioned, and I always repeat it, and I have it in my mind whenever I'm speaking or talking with a patient, and we're on the verge of deciding to do the surgery, is that just forget that he's a patient and look at him as if he's your father or your brother, your son maybe. That way you will guarantee to be transparent, fair, wise, responsible when you take a decision or make a decision of performing such a surgery. I know it's an amazing surgery. The results are 100% guaranteed after the surgery, especially for those that 100% need it. And I always say that your satisfaction is equal exactly to how much you need the surgery. which brings me to a question I'd like our audience to hear from one of the world's renowned experts in this field. What are the true indications for performing such a surgery of penile implant surgery?
So we have certain of criteria, and we call them guidelines, and there are a lot of guidelines in the world, but mainly we use European guidelines as a German certified urologist, but there are American guidelines and Egyptian guidelines. And so we recommend for the patients to have prosthesis if the other ways of treatment are failed. So there are a lot of possibilities to treat the patients by the drugs, by having tablets, and you have to try with this first, and then you can switch if it doesn't work, or as additional treatment option to give them shots or injections that could be done in the office, or it can be done by the patients themselves. And then you can also have modern treatment options like shockwave treatment and other adjunctive methods of truth, like a PRP or a combination. And if in the end that all these methods of treatments and their combinations have failed, you can recommend penile prosthesis.
So this is the honest way of managing such patients, is that you have to go by the in a stepwise manner of treating the patient, starting from the less invasive until you reach what we call the final resort of penile prosthesis implantation. Is that right?
Well, that's what guidelines are recommending. Of course, this is only recommendations, and we nowadays have a shift from in the mentality of making a decision, because we have a number of patients, for example, after prostatectomy, so removal of the prostate because of cancer, and of course, in order to implant prosthesis in these patients, you shouldn't
wait so long.
Wait so long and keep giving pills if it makes no sense, because he was operated and the nerves are removed, so you can skip to another stage, and for example, to use shots, to use injections, and then finally, in order to prevent severe complications like the loss of length of the penis, you can recommend straight penile prosthesis.
Correct, because I think this is a major concern for the patients, not just the function, the size. And the more you wait, I mean, there was a nice study on that by the year. I mean, you lose length because it's considered as atrophy to the tissues. And even if you don't just lose the length, it makes the surgery, I think, harder afterwards. And maybe there's fibrosis in certain areas that causes maybe deformities in the shape of the penis. I mean, in your hands, I'm sure that you're going to end up with the best result. But in losing size isn't that big. And patients, nowadays with the marketing and the media, that especially with the new implants that increase in length and girth, they think that this could be easily overcome by using such an implant. But I always tell my patients, I mean, yes, the implants increase in length and girth, but then again, the determining factor is the nature of the tissues and how pliable and acceptable and compliant will the tissues be to give you such a benefit. What do you say to your patients?
Well, maybe three facts about this. First of all, the study you mentioned, there are a lot of them, but one of the oldest study was done by Peter Walsh, and Peter Walsh was the surgeon who invented radical prostatectomy, and he measured the size of the penis after prostatectomy, or the length of the penis, and find out that you can lose, in case of non-sparing prostatectomy, up to 5 and sometimes 7 centimeter of the penile length, which is huge. And you can work against this, preventing this, by putting penile prosthesis, because there is another studies demonstrating that penile prosthesis work as a tissue expander. So the power of penile prosthesis, or hydraulic pressure of the prosthesis, works against the shortening of the penis, and you can use it as a tissue expander. But important is to notice that penile prosthesis will never ever make your penis longer. This is impossible. Even if you have models which are supposed to prolongate the penis, there are a lot of brands that have this feature to make the penis longer, but in the real life, the tissue expansion of the penis is so hard, so that there is no prosthesis in the wall which can make the penis longer. And this is again something which you have to explain to your patients, because they have sometimes unrealistic expectations, especially after getting this information that there are some prostheses that may increase the penile length. This is not the 100% truth. There are prostheses they can expand, but outside the body of the patient, not inside the body.
That's what I say. They say that sometimes they even say, I know that outside the body they expand 25%. Imagine the expectations of the patients when they hear such information. You notice something when you talked about the expansion or the penile prosthesis per se. We're talking about expansion. I mean, we're just talking about the inflatable types, with no mention of the malleable, which shows the huge difference, or maybe say there's no comparison between both, or maybe let's say it by default, the best implant to use is the inflatable. I know this is established information already worldwide, and here in our region, we've been educating our patients about the difference between the inflatable implants and the malleable implants. And nowadays, I mean, there's a paradigm shift. Long ago, patients used to be afraid about to hear about inflatable, and they only stuck to malleable, fearing a lot of fears, more complications, more incidents of infection, of malfunction. But nowadays, they understand the difference and they appreciate the difference, and they come asking for the inflatable from the beginning. Even the patients that cannot afford the inflatable, they come to the clinic and they tell me, Doctor, don't worry, I know that I completely understand, appreciate the difference between both, but I cannot afford. And my advice at the time is that if you cannot afford, even in the near future, then at least you could settle for a malleable, because at least you have to have, if you don't reach the 100%, let's say 95% of satisfaction, I think the malleables would give you at least 70%, 80%. They could do the job, let's say. So I'd like to hear it again, because to date, I know patients that don't even know about the implants. Physicians even don't know about implants. So, Daniel, if you just could enlighten us about the major differences between the inflatables and the malleables, and why is the malleable the number one implant?
So the malleable in general is a prosthesis which can be manipulated by the patient. And if the patient wants to have sex, I'm just telling open text, they have to elevate the prosthesis, to bend prosthesis towards his face, and then he has erection, and then he can bend it down after finishing.
I'm sorry, Daniel, I said malleable is the number one implant. I meant that inflatable is the number one implant. Please.
Well, the second type of prosthesis is hydraulic, so you can have more rigidity, so more strength of the penis by inflating device with the fluid, which is saline, and you can transport the fluid from the reservoir using the pump to the cylinders, and then you will have stronger erection than malleable prosthesis, and of course the overall quality is better. However, there are a lot of studies demonstrating that the people having hydraulic prosthesis, there was a survey asking them how much in the year, how many times a day, or how many days in a year they use the prosthesis. And well, the reality is a lot of people use them only a few times in a year. And instead of having this type of prosthesis, it may be reasonable to have a simple one, which has also, well, less rigidity, but enough rigidity to have sexual intercourse. Even if you a younger patient, the modern devices gives you more rigidity and more satisfaction with the end result than the generations before of the devices. Of course, as a surgeon, I would recommend hydraulic prosthesis, but if you want a hydraulic prosthesis, get it in the right place, because you can put the malleable prosthesis in the easiest way. There are less complications. not only for patients but for the surgeons. But if you want to have a proper device, hydraulic prosthesis, get it in the proper place.
That's number one advice, is to always seek a proper place, not a proper place, the best place. And I think the best place would be a certified place, a place known to have a high volume of surgeries done, because I mean, experience cannot be skipped, cannot be purchased. You have to have experience, have to have past time, and do as many surgeries as you can. And that's why we have the high volume implanters and the low volume implanters. And I know that the high volume implanters have been originally defined as 50 implants per year, but I think this number has to go up a little. And I know that there are 5 centers of excellence in Europe. I was blessed to have my fellowship at one at your facility, at your hospital, which is one of the centers of excellence that were certified by Professor Wilson, Papa, or the master himself.
So, and Center of Excellence or the dedicated centers are very important, and we decided to create them all over the world. And the criteria, not only the number of devices, but also dedication to this field. And we are looking for the people who are really dedicated and passionate for this type of surgery, because once again, we are treating not only disease, we are treating the fate of the patient. We help the patient to be happier, and this is very unique situation in my opinion. And you asked me about the complications or what can make decision of the patients to have a prosthesis easy.
Yes, what I meant was that the patient comes to you and he's 100% indicated for the surgery, but he has like they call cold feet, is like I'm doctor, I heard about complications, and like you said, we have to be transparent and honest. Yes, there are complications, very, very minimal risk of complications of infection, malfunction, and other less or minor complications. But then again, what is your answer to the patient when you see that he really needs the implant? If he doesn't go on with the implant, I mean, then he'll be losing something important.
So I have only what I can give them advice to have a prosthesis, not only because I want to sell the prosthesis. By the way, I'm not selling them, but I want to help them. The health care specialist, and there are top 5 things you have to know before getting prosthesis. Number 1, penile length. Well, you will not have your penis longer. This is impossible, but you will have your penis functioning again. So if you're comparing the situation before the surgery and after the surgery, you will be able to have sex. Number 2, can the prosthesis make you attractive for the woman? Not. That will not change your mind. You will be the same guy, but you will be able to have a sexual intercourse. This is important. Number 3, whether the infections rate, because this is the artificial material which is implanting into your body, the current studies demonstrating the risk of infections lower than 1%. So the risk of having infection, if it's done in an appropriate facility, is lower than 1%. This is the known evidence-based data. Number 4, try to talk to your partner and not to make a decision by yourself. And in order to encourage the partner, you can give following evidence. There was a study asking the partner after getting penile prosthesis whether they will recommend same operation for the other couples. And they were asking men and a woman. And from perspective of women, they would recommend implantation of this device to other couples in 92-93%, which is really high. So, and try to involve your partner in the decision making, because this is what you're working for. You want to be active again, and that decision should be made with your wife. And number 5 is mechanical reliability of the prosthesis. This study of Stephen Wilson, published many years ago, demonstrating that 75% of devices survive 15 years. So it means after 15 years of the surgery, 75 prostheses are still working. And I have some patients from 90s, not from me. They implanted by my previous colleague.
Mm-hmm.
They're still coming and with still functioning device.
That's great information, and that's great advice and solid information based on science. May I ask you a question? It might sound as a trivial question, but believe me, we get this question all the time when you spoke about the spouse or the wife or the partner. Doctor, will my wife know about the surgery? I mean, can I hide it from her? I mean, especially I know that you receive Arab patients as well in Germany. What's your honest response to them?
Well, honestly, if you compare the quality of sexual intercourse in terms of giving a pleasure to your partner, this is no difference. Even more, there is a study that described that the rigidity, the hardness of the penis, is much higher than physiological erection. So it's from this perspective, this is even better than the physiological erection, and you have more girth because the prostheses, they cannot extend towards the length of the penis, but they can gain the girth, which is mostly important for female orgasm.
That's right.
And the second important information that, of course, if you can feel the pump in the scrotum, you cannot hide it. Actually, the question is whether you should hide it. Well, I think if you should tell the truth, because let me tell you one story. A lot of people thinking that this is artificial and the God or Allah has not developed this. Yes, but the Allah and the God has not developed an airplane. And if so, you should walk to Germany or to United States by your feet. You should walk there and not fly. And the airplanes are also something which human being developed to make us mobile, and penile prosthesis is developed by the humans just to make you happier.
And if we speak about God and Allah, He's the one who blessed us or granted us with the science to make. And we have a saying in Arabic. I'll say it in Arabic: لكل داء دواء. For every disease, there's a remedy. So this is a remedy. And when you speak about erection, one of the fears of the patient is that I won't be natural. I won't be a human being anymore. Of the patient and of the partner. Maybe sometimes I hear my husband, we transform into a robot, and I told him no. The implant provides only rigidity. Period. Only rigidity. The feelings, the desire, the sensation, the pleasure, the orgasm, everything is completely natural. Completely natural. It's just we added just the element of rigidity, and that's it. Isn't that true?
That is true. Yes, of course. It is better to fix the problem without putting artificial material. I agree with this completely, but this is something which has proven over 53 years, because the first prosthesis from this its modern look was developed in 1972, and 53 years of experience, 53 years of surgery and evidence, and they all say that the prosthesis can improve the life of the patient and of the couples immense, and that it helped to save the family life and to improve the partnership. And I think it is something important, and I don't think that any robot in the world can improve that. And I am not saying that this piece of plastic will improve your life, but the way how we implant it and the way how we change the life of the couple will improve it. And this is magic, and maybe it comes from the other levels. Maybe it comes from Allah.
I love the word magic. It is magic, and we witness that every day with our patients. And I just want the patients to rest assured that it's a simple surgery. It takes, in the best hands, it takes maybe less than 40 minutes with how can I say it? with a unbelievable result afterwards. Let's say a life-changing result afterwards. Everything is completely concealed. The surgery is performed through a very small buttonhole incision. It doesn't matter where the incision is, because nowadays with the marketing, some people or some surgeons market that this incision is better than the other. There's a superior incision, although they're all ways to the same fate at the end. They lead to the same success. And it's just a matter of maybe the patient's condition, number one, where you choose where you open your surgery, and number two, to the experience or the comfort of the surgeon. Having that said, Daniel, I know it's been a very long day today, and I appreciate everything you've done for me, everything you continue to do for me. And I always remember, I told you from the very first week I was in Germany, and you might have been surprised. It's too premature to say that, but I felt that from my heart, that I was blessed to have chosen this destination, Germany, University Hospital Schleswig-Holstein, to be with Professor Osmanov himself. And it's paying off every day. I mean, putting aside our work, our surgeries, it's a blessing from God to have you as a brother.
Thank you, Ahmed. It was a pleasure to see you in Egypt.
The pleasure is all ours, and please let it be just the beginning, and we do it again and again and again. Please.
Well, I was invited by the Egyptian Association of Urology to attend on the annual meeting, and I have a nice talk tomorrow. But this is not the only one mission, and Barbara and Stephen Wilson Foundation and Rigican Company sent me as an ambassador, and I want to hand out you with the certificate of the global appreciation demonstrated
so much,
and indicating that you are nominated and you was a winner to be a center of global reference for the penile prosthetic in Egypt. And actually, I was the last one who got this certification last year, and now you're my previous fellow and my current brother. So getting the next one. This is
Daniel.
This is for you.
I'm so speechless and honored. I don't know what to say. I mean, it's honestly, it's a surprise. You didn't even mention. I mean, sometimes you give me hints, but this time you gave me no hint at all. I'm honored. I'm speechless. I don't know what to say, especially that it comes from my two favorite mentors in life, Professor Wilson, the master himself, Papa himself, and my dear brother, Daniar, Professor Osmanov. When it comes from you, it means a lot. From my mentor, where I learned a lot, and to be second after you, I mean, that's a totally different story. Thank you so much. I know, how hard is it to earn such a recognition? So I'm honored. I appreciate it, and this will have a designated wall in my clinic.
And again, this is we have a criteria not only in the number of implantation, but the dedication to our field. And you're dedicated, and you're persistent in what are you doing, and you're working for the patients and with the patients, and we are very happy to have you in our family. And as another side, I would like to give you this nice textbook, which is published, and this is the official textbook of the European Society for Sexual Medicine on urologic prosthetic surgery. It was edited by Professor Mancada, Professor Juan Martinez Salamanca, Professor Lieda Garcia, as well as John Mulcahy. This is for you.
Best of the best. The best. Thank you so much, Daniel. I mean, it's like it's holiday season. You get to gifts, very valuable gifts. This is another pleasure and privilege to get this book, because I know this is the very first official book for the European Society of Sexual Medicine, my beloved and favorite society, where it all started. With the fellowship, with the society, and I'm I know how hard or the great job you're doing with the society, because I'm another honor is that to be a member of the educational committee, and you're the chair of the educational committee, and I know how hard you work.
Well, the Surgical Academy, it's an initiative of the European Society for Sexual Medicine, and we want to standardize the global education on penile prosthetic urology, specifically in the field of prosthetic urology. And this is the very first textbook which we handing out to the members of the Surgical Academy and to those of our specialists who wants to learn IPP prosthetic urology.
And again, this is another proof of the great job you're doing, Daniel, with the society. I think this will be a Bible for anyone, like you said, passionate about this profession and this these kinds of surgeries. I'm really grateful, Daniel. Thank you so much, and blessed, as I said from the very first week. Thank you so much. This means a lot, and may God help us continue to learn and teach at the same time, and serve our patients better and better every day.
Thank you, Ahmed.
Thank you, Daniel.